It is truly such an honor to have these three incredible minds here tonight. I was thinking, like, this kind of feels like a free consultation. I love it, and I'm so grateful for it. And thank you, ladies, for submitting these questions. I was reading through them, and I was like, oh, God bless our panelists. It's going to be a really good night. So I just wanted to introduce you to, we have Dr. Kristie on the far left here, my left, your right. We have Dr. Robyn in the center, and then we have Dr. Brenda here on your left. Awesome. So if you ladies wouldn't mind just introducing yourselves. I mean, I guess I kind of already did that, but if you could please just let us know a little bit about yourselves, that would be wonderful.
Sure, I'll start. I didn't prepare anything, so sorry. Well, my name is Kristie Gering. I grew up in South Dakota. I'm a transplant to Wisconsin, came over here for residency and loved it, so we stayed. I've always wanted to do medicine. I was like 5 years old and watching Marcus Welby, so I was the only one in my house watching that. And the Lord has taken me down lots of different paths. I try to keep an open mind, but so during residency, I always felt like there had to be something more, and I always wanted to know the whys. Why did this work? Why did this not work? And, long story short, God led me to functional medicine, so I was able to take some extra courses and had this big aha. We need to work with God's design, and there's a whole body of research that's showing that we can do that. It was just so exciting and also infuriating because the whole 4 years of med school kind of detoured us from that. But so anyway, long story short, I opened up a clinic in 2017 because I realized it's really hard to do this in a standard medical setting. And God's blessed it the whole way. In a couple years, I felt I was drowning, and He brought me Dr. Robyn, and I felt that He was preparing a heart and someone ready to serve in the functional medicine realm, and there she was. So it was a whole big gift, and it's just been a series of gifts the whole way. I don't know. So I'm married. I have a daughter. I've got 2 dogs. I love being outdoors. And I love Jesus.
And she is amazingly brilliant, and I'm so grateful I get to work with her. She's very humble, but very brilliant, and I'm so grateful. And so I'm Dr. Robyn. You can call me that. You don't call me Dr. Endrud. It's uncomfortable. But I came to know Jesus at 22 and was filled with the Holy Spirit. And that was before I went to med school. I ended up working for a Christian physician before I went to med school to learn how can I incorporate my faith in practice. And then that launched me into med school. I met my husband, had 3 babies in med school and residency. By the grace of God. and then I did family practice like Dr. Gering did. Delivered babies, worked in the hospital and in the clinic, and I loved it. And I live and work in Menominee, or not work there anymore, but I did for 7 years and got to know the community, and I loved it, truly loved it. And then in 2020, in a time in prayer, the Lord, I heard Him as clear as day say, "Are you willing to let go of everything you know?" And I thought, the Lord wants me to move. I had no idea. I even told my best friend, I think we're moving. I'm like, I don't know. This is what I heard the Lord say. And over the course of that year, the Lord pulled back the veil for me to see what was all wrong with everything that I had learned. And I had to let go of everything I had learned. And He told me to leave my job. My husband had already lost his job. So he lost his job, and then he was telling me, you need to leave. And I was like, what are you doing to me? I feel like I'm jumping off a cliff. And God's story, because I want to share it. I mean, it is supernatural. Like, I'm praying in the Spirit, and I'm seeing like a map, and I see Chippewa Falls, and I'm like, okay, the Lord wants me to open a clinic in Chippewa Falls, and that's all I knew. I'm going to work in Chippewa Falls. And then he said, I want you to go on a walk with a friend of a friend. I don't know her. I'm like, okay. So I call her up, and we're set up to go for a walk after work one day. That day I go to work, and my colleague comes in. I have the only microwave. She's warming up her food, and she said, oh, it's the craziest thing. I had a dream about you last night. And I'm like, really? And she said, yeah, you were quitting. She said, your last day was going to be December 1st. And I'm like, okay, interesting. And this was in September. And I'm like, okay, I'm listening, God. Later that day, I go on a walk with my friend of a friend, and I'm telling her what I'm seeing, like what the Lord's showing me. And she said, you know, there's a functional medicine doctor in Chippewa? And I'm like, no, I didn't know that. And she's like, yeah, I've seen her. And I'm like, okay. I'm like, what's the chance she's a believer, though? I'm not yoking myself, just somebody who's not a believer, you know? And so I look it up, and I send a little message on the website. Kristie's got COVID, and she's home. And she gets it. She texts me the very next day, and she said, I've been asking the Lord to send me somebody, and I wanted to put an ad out, but he said, no, I'm getting somebody who's ready for you. And so yeah. So December, I left my job at Mayo Clinic, and then started January 2nd at Sparrow. So, and God's just kind of blessed it the whole way. So he orchestrates our steps, does he not? So he's good, and yeah, so it pays to follow Jesus. You know, the pay isn't the same, the benefits aren't there, but Lord, there's heavenly benefits, you know, that are way better, and I get to do what I feel is real medicine now, and I'm just so grateful. And so yeah, other things, I think I said I have 3 kiddos, and I do a podcast with my friend. We talk about medical stuff and non-medical stuff. It's called Hearts for the Kingdom. Shars, come on. And then this past year, what was burning in my heart was actually this. Like, I want to bring this to the body of Christ. Like, I want the body of Christ to know how to be well in every aspect, body, soul, and spirit, and for us to address all 3 at the same time. And so I started a ministry called Transforming the Temple, and this past year had our first 3-month course where I walked people through metabolic health for 3 months and dealt with body, soul, and spirit. So anyway, so it's been busy, but God is good. Mm-hmm.
Awesome. Well, hey everybody. My name is Dr. Brenda Kibola. I grew up in Nairobi, Kenya. And I came here when I was 19. I came on scholarship. And throughout my undergrad, it was a very interesting experience coming from Kenya to the United States, and it was very overwhelming. I remember that I went to Subway that first day, and I was ordering lunch, and they said, "What type of bread do you want?" And I was like, "How many types are there?" And so I just said, just get anything. And so then, okay, what type of meat? Meat was okay. I was like, oh yeah, beef, whatever. And then it's like, do you want cheese? What type of cheese? I was like so overwhelmed by that single experience. But anyway, God is good. I sought God. I said, Lord, you created me for a purpose. What do you want me to do? Where do you want me to go? Take me where you want me to be. And I didn't want to go to medical school, but I guess that's what God had in store for me. I thought it would take too long. I thought it was just too long, too much work, too much commitment. I wanted to settle down. I wanted to have a family. But anyway, God has his plans. And so I go to medical school, and I'm like, I don't know what you want me to specialize in. And in third year of medical school, because I didn't know about psychiatry, I went on my rotation, and I loved it. And I was like, wow. Every morning I would wake up to go to the inpatient unit. I was excited. And so I tell my family I want to do psychiatry. This is my family in Kenya. And they weren't thrilled about it. There's a lot of stigma with mental health, and they were like, oh, why can't you be a pediatrician or something else? And I was like, no, I'll just follow God's path. So I just ignored their calls for the path was set, and by then it was too late. And so, but it's been a beautiful journey. I really, really love what I do. I love it. I don't feel like I'm working. My family, we were posted to Rice Lake, Wisconsin, here in 2018 for work, and we liked it. We stayed. I had a nice, Marshfield was good to me. And 2022, the Lord started saying, hey, you need to open a Christian practice. And I was like, Lord, I can talk about God in the office. I don't need to open a practice that's Christian. But I started to feel such a pressure in me that I was going to explode, that I just had to hand in my resignation. And then went on this journey of starting a practice. And the practice is currently present. It's called Brenda Clinic. It's a Christian psychiatric mental health practice, and we have 2 locations in Eau Claire and Rice Lake, and we are slowly growing. God has been good. Just like Dr. Gering, we have never really posted for jobs. People come to us, and it's usually people who the Lord has ordained. So it's been such a growth in my own journey with the Lord, and I have a family. I have 3 young children who keep me busy after work, 5, 3, and 2, and so I have a very long days, but I thank the Lord for that. Amen.
Well, thank you, ladies, again so much for being here this evening. It is such a blessing, and I think we're just going to jump right into questions. I do have to say, though, Rachel's got it. If you have any questions that you would like to submit throughout the panel, Pastor Shar is actually going to be receiving those questions. So if she freaks out a little bit, it's because your question was really good. Or not so good. So feel free, if you have any questions at all, follow-up questions, something new that you're inspired to ask, text that number, and Pastor Shar will get it on her iPad and either ask it or ask me to ask it if she's too afraid. I'm kidding. I'm kidding. So we're gonna jump in with Dr. Robyn. If you don't mind, I'll have you start. We're gonna keep it a little mellow to start, ladies. So the first question I have is, what are some proven natural remedies for hair loss as women age?
Yeah. So there is no good answer for this, but so it's going to be not so satisfying, but this is what functional medicine does well. There's like a root cause, and everybody's root cause is different, okay? So that's why you're all scratching your head, because there is no magic sauce that works for everybody, okay? So things that I think about, though, started just kind of doing a brain dump of what are the things I start thinking about. Stress is one of them, okay, major. Even a major life event like a major sickness, even we saw this with COVID, right? Or pregnancy and delivery, you can actually have a massive hair loss. Usually it happens about 3 months after the event. Okay, so you shift over into something we call telogen effluvium. Every hair shifts over into the telogen phase and it sheds. Okay, the good news is it'll
Not
come
every
back.
hair. Not every hair.
Yeah, not every
You
hair.
get to keep a quarter.
Most hair.
1/4.
This happened to me every single
Yes.
pregnancy. Oh, it's horrible. It takes about a year for you to finally have normal hair again. But stress causes hormone imbalances. Chronic stress causes hormone imbalances. It increases inflammation, makes you more insulin resistant, and it actually can even change how you break down testosterone. So testosterone itself it doesn't necessarily cause hair loss, but the breakdown product, it's called DHT. If you have high levels of this, that can actually cause a type of hair loss that tends to follow more of a male pattern. Yeah, so you kind of have that power alleys, my husband calls them. But so you might notice more hair thinning in those areas. There are natural things that can actually slow that down, can slow down that enzyme so you can bump up your testosterone. So actually a lot of people have low testosterone levels, so that's a natural way too. You can bump it up is saw palmetto. So it's an herb that you can take that will slow down that enzyme. So that can be helpful. Other things is just think about different deficiencies, and there's a number of them. So different B vitamins. A lot of people hear about biotin, like everybody knows, biotin is one of them, but other B vitamins, iron, vitamin C, magnesium, zinc, selenium. So a lot of these different nutrients and deficiencies can actually cause hair loss. I also encourage you to think about medications, certain medications that can actually cause hair loss, and toxins. We do so much to our hair, and a lot of these products are very toxic and can actually promote hair thinning. There's an app that I love to use, a couple of them, the EWG app and the Yucca app. You can scan your products and see how toxic or non-toxic they are and find better options. So those are all things that I think about. Red light therapy can be helpful too. You have to be pretty diligent about using it. I would use it probably 6 days a week, 5 minutes close up to the scalp. That actually can help with hair regrowth. And there is, so if you're looking for like an easy, so Orthomolecular makes a product called Cosmodex. It actually has saw palmetto in it, and it also has all those nutrients I mentioned all in one thing. So that can be an easy one that I'll recommend to patients. Like if you're just trying to cross things off your list that might be causing your hair thinning, that's a nice one. And then the last thing I'll mention is peptide therapy. So there's peptide called GHK. Typically that's needed to be injected, but there is a company called Quicksilver Scientific that actually made a liposomal formulation that's easily absorbed that you can actually use both orally and topically on the scalp. It's called copper GHK. That can be helpful too. That's actually a newer one that's come out on the market. So it is not an easy one to start with, actually.
Oh, so sorry.
Thyroid. Yeah.
Yeah. Thanks, Dita. Yeah, I was wondering, Dr. Robyn, before we move on, if you could just say those apps and the products one more time so that the ladies would have a chance to write them down.
Yeah, so the apps, I love these. I use them all the time. EWG, this Environmental Working Group, they have an app. It actually has a little scanner. So you can walk around and scan all the stuff you have at home, and it will score it. The other one I use is the Yucca app, YUKA. I don't agree with all the food advice it gives because you can scan food too, but for products I really like it, and it will scan like makeups and your shampoos and all that stuff. So those are ones I like. The supplement that I like that I often recommend to patients is from Orthomolecular, and it's called Cosmodex. It's COSMEDIX.
Perfect.
Yeah.
Thank you so much.
Yeah.
Awesome. All right. Well, we'll move on with the next question here for Dr. Brenda, if you don't mind. I am wondering if you can explain how physical health can impact our mental health, and also what can we do to support our bodies, supplements for immunity, things like that.
So that's a really great question. How can physical health impact our mental health? This was actually one of the reasons that I had to branch out in my practice of psychiatry, because I would get patients. I'm trained in psychiatry and mental health, but I would get patients, and everything that I learned in medical school, I would do. And there are just some patients that wouldn't get better. And this really frustrated me because there was more, but I didn't know what it was. And so I would refer people to different specialists. I would say, hey, go see GI, go see neurology, go see rheumatology. And they would go, and the answers they would come back with were unsatisfactory. And so there is a whole... Our bodies are a system. Our bodies are an ecosystem. Anything that affects one part of the body affects every part of the body. And this is really where I think medicine struggles in the US. We are very, very advanced, but the specialization doesn't allow us to see the body as a whole. So I'll say when I see my patients, some of the most common comorbid is basically other medical conditions that they come with. A lot of them come with digestive problems. A lot of my patients who come to me with depression and anxiety, they come with digestive problems. A lot of patients who come to me for depression, anxiety, mood swings, they have chronic pain. A lot of them have chronic fatigue. A lot of them have brain fog. A lot of them have a lot of other issues that the depression and anxiety is just one part of it. And so the beauty about functional medicine is that you kind of take a step back and say, okay, I see this depression and anxiety, but what else is going on in the body that the depression and anxiety may just be an indicator of? It may just be one piece of the puzzle. And so what I recommend to individuals is to look for a functional medicine doctor, like Dr. Gering, because really you can get lost in the process if you're not sure what you're doing. With functional medicine, so I have a lot of patients and they get labs and they're like, my labs are great, but I don't feel good. And the labs that we get, I say this in mainstream medicine, they detect the big, bad monster. So when something is already really, really bad and really at a really not unsalvageable, but really difficult to treat point, that's when it's like, oh, there's something wrong here. But there are other things that have been going on over the years, over time, that build up. And that's why a lot of the more functional tests are great, because they're specialized. You're able to see, okay, what's going on in the gut? Are my digestive enzymes working? Am I breaking down food and absorbing nutrients the way I need to? And am I even having enough amino acids to make the neurotransmitters like serotonin, norepinephrine, to not be depressed or to not feel so crappy? So there's a whole overlap. And what I advise people to do is to start to learn to listen to your body, We are very distracted in this world, and we don't know the art of listening to our bodies. And so if you could even take 2 weeks to just listen to your body. What did I eat today? How do I feel? What time did I sleep? How many hours of sleep did I get? How did I feel the next day? What am I drinking? what is going on in my life? If you for 2 weeks can log every single thing that you can about how your body works, you will learn to see, okay, my body doesn't like this. Why doesn't it like this, right? And so that data is really good, because when you come to a doctor like Dr. Gering, Dr. Robyn, or myself, you're coming with data and saying, here, this is everything I can gather, and I want more information. I want to understand this better. And so then the work is more productive, and the work also can go faster. So that was a long answer, but yes. What supplements to take for immunity? Well, for immunity, your immune system typically, right, it's the vitamin C, vitamin D, zinc, and what else? A. Yeah. So those are what you would take to build your immune system. But like I said, it's one part of a whole picture. So you might be trying to build your immune system, but your immune system may be dysregulated. It may be attacking your own body. You have an autoimmune condition. So it's, there's a lot more.
Can I add on to that? So I thought it was really interesting. There was a study they did looking at a toxin called LPS that bacteria in the gut release. And if you don't have a healthy gut barrier, it gets into the rest of the body. And so what they did is they actually took that toxin and injected it into people. And you know what it caused? Depression. So there is a connection between high levels of toxins in the body, particularly that come from the gut, and it impacting our mood. It's important to know most of your neurotransmitters are made in the gut. Most of your immune system is also in the gut. So that tends to be the first place we start digging when someone comes to see us, is how is the gut doing and what's going on in there. If we deal with that first, it's like there's a lot less for us to deal with.
Yes, 100%. I agree. Yeah. So 75 to 80% of your serotonin is made here. So if your gut's not healthy, it's really hard for your brain to overcome that. And that LPS, if you actually get enough of the LPS, like if you dip a dart in it and you put it in someone's arm, they could actually die of sepsis. It causes inflammation. And we know inflammation can cause brain, issues, so anxiety and depression. One of the other tools that we have is we can do neurotransmitter testing. So we can actually look at your urine and see what your neurotransmitter levels are. And that can give us huge clues as to what's going on, especially with regard to like amino acids, enzymes that might not be working right, like B vitamins or cofactors to make the enzymes work better. So there's a lot of things that you can do to help support the body, and the brain and the mind.
On that note, Dr. Gering, if you can maybe touch on, is there a cleanse that you would recommend for the gut? Some kind of a cleanse for the gut to get it restarted or cleaned out?
A cleanse. Okay, well, that's a great question, and there's lots of different thoughts about cleanses. First of all, I want to apologize to all of you. I might be looking over here and over here, or maybe over here and here. I have a lazy eye that's getting worse. So, and as the day goes on, it gets worse. So, sorry, I'm cross-eyed. So I'm not drunk, it's just cross-eyed. All right, so a cleanse. One of the things that we think of with a cleanse is like getting the poo out, right? So many of us struggle to have a regular bowel movement. And a very simple cleanse would be to actually just do what we call a vitamin C cleanse. So this is where you take vitamin C, a very purified form of vitamin C called L-ascorbate that is buffered, meaning it's got minerals in it. We have one at our clinic that we use called PERC. And you take a dose of that every 15 minutes. And do this with a friend. It's really fun. Make sure you have two bathrooms. So Every 15 minutes, you take a shot of this vitamin C. You're going to start using the bathroom. Keep going. All of a sudden, you're going to realize, I don't dare pass gas because I'm not sure what's going to go. And you'll go and you'll basically, if anyone's had a colonoscopy cleanse, that's the experience you'll have. You will literally pass water. So what this does is obviously it cleans out all the stuck poo that's in there, and then it tells us how much vitamin C does your body need. So typically then your body is calling for about half of whatever it took to get to the cleanse. So for example, for me, my first time that I did it, it was 18 grams. So we think about 1 gram or 1,000 milligrams as what you take if you get a cold. It took 18 of those for me to have my cleanse, meaning that my body was asking for 9 grams of vitamin C every day. And it asked for that for quite some time. And then maybe 3 months into it, I started having kind of squishy poo. So I did another cleanse, and it took only 8 grams to get the flush. And so then I only needed 4 grams of vitamin C a day. So that's a simple gut cleanse. There's lots of different cleanses, but that's just one. Dr. Robyn, you have another idea?
I think it's just a loaded question because I put people on different kinds of cleanses. Yes. Like you want a parasite cleanse. I think you got parasites going on. It just can look different. But I just start thinking about people just need to cleanse their body. If I can get people to do like whole food diet for a month, like that's the kind of cleanse that people really need to start with. And then I start looking at, okay, what's your gut like after I get you on whole food? And if they're backed up or we're seeing other issues, I might move on to doing a more serious cleanse after that. But when you up your fiber intake when you're eating a whole food, you'll be amazed how well your poops are after that.
Absolutely. And a lot of times we ask patients to, when they come to us initially, please think about doing even 3 weeks of no gluten, no dairy, no sugar. It sounds impossible, but it's not. And many people will find a huge change in how they feel. So just that alone, and that's a good first step that you could do without us. So
I just had a patient thinking about mental health today, a 17-year-old who had been having severe fatigue, brain fog, moodiness, irritable. Mom's bringing her in like, we can't take this anymore. So I challenged her to do that. No gluten, no dairy, no sugar. They're convinced she's got long COVID, like all these different diagnoses. She came back. She's like, oh my God, I'm not bloated. I'm not constipated. I'm not fatigued. I don't have brain fog. And the second I ate gluten again, it all came back. And I'm like, yeah. So, and her mood is doing better. So it's amazing how much food makes a difference too. So.
Yeah, I do have to say that I literally just did that, and all of the inflammation in my body left, the bloating, everything left. I lost weight, my skin cleared up, and then the moment I reintroduced things like that, I have acne again. It's beautiful. Like my pants don't fit anymore. So it is really crazy how food does that to us. Yeah, I do just want to say, ladies, all of this is being recorded right now. So if you want to re-listen to the cleanses that they had just mentioned, the video will be posted later. So you'll be able to come back and do that vitamin C thing with all your besties. So it'll be really fun. My sister does this poop tracker app with her friend, and they send pictures of, it's crazy. So it's fun. It's a bonding experience. So it's good. We love those friendships. So anyways, Dr. Kristie, this next question is for you. If we can get there. There is someone wondering what your thoughts are on the weight loss shots and drops circulating. I know that Ozempic's been a really big thing and things like that.
Yeah, that's a great question. So Ozempic and Wegovy are GLP-1 agonists. So this is a hormone that's in our body that helps us feel satisfied and not hungry. It also kind of just makes us feel full. And we naturally make it, but there are things that can disrupt that. And so the Ozempics and the Wegovy's, they're called semaglutide. Yeah. I butcher that one, but anyway, it's hard to pronounce, but semaglutide. So you can use it in different ways. I do think that on occasion, doing the injection form can be appropriate for certain people who have some really advanced issues. I believe that it's being a lot of it overused. There's really no quick fix, right? So weight loss, if there's no free lunch. So if you take Wegovy or do the injections, your appetite will go down and people will lose weight, and sometimes very rapidly. Unfortunately, what happens is that you lose so much weight that generally it's your muscle mass. And so people are losing, 20, 40, 60 pounds in, just a couple of months. And now 4 months later, a year later, when they can't afford the shots anymore and they go off of them, what happens? The weight goes back up, their metabolism is crashing because they don't have muscle anymore. And so they're going to actually not just regain the weight, they're going to basically pack on way more fat. And that's not what you want. We can do it in different ways. So we do have some patients that we've used like Ozempic with in smaller doses. So we try and dose it in a way in conjunction with our dietitian to make sure that you're not losing muscle, that you're eating enough protein. So it can be done safely. We also are doing smaller micro doses underneath the tongue, so you don't have to do the shot. And that can be helpful. So we have had patients that are doing that. There are probiotics that you can use that can increase GLP-1 naturally. And then there's a new product that we're just starting to investigate that we're probably going to offer at the clinic called CaloCurb. It's actually bitter hops from New Zealand. And so the bitterness of those hops actually there's bitter receptors in our intestine. These bitter receptors will dump out bile, so it's going to help you detox, but it also happens to increase GLP-1. So it will naturally increase your own GLP-1 that's been knocked down for a variety of reasons. So it can help, and it's been studied for 14 years and has very little side effects. So as far as risk profile, it's pretty minimal. I think that there's a place, but I think it's way overused. And I think most people, I hate to say this, and I don't want to predict it, but I'm afraid in about 5 years, you're going to start hearing commercials from lawyers saying, have you tried blah, blah, blah? If so, call our law firm. So anyway.
I think too, it's important to deal with root cause. So I'm willing to use it with patients, and I have one who is a beautiful example. She was so sick when she came to see me, and we've dealt with mold, Lyme, like all these different issues, and she's doing so much better, so much better. She has her life back, but the weight is not leaving, and she's still inflamed. So we've done, and we know it can help with inflammation, and so we've done lower dosages. The kicker is that her insurance is like mad that we're not going higher. They're almost saying we can't use it because I'm not using the max dose, which makes me so mad. But we fought through it. But she's finally losing weight, but it's at a slow pace, like a pound a week. And she's maintaining muscle. So I make her, actually, we have a special scale that I make her use so I can follow her skeletal muscle mass. And I say, if you're losing muscle, we stop. And so I make her do weight training. So there's a right way to do it. And so I think it can be used in the right situation.
Yes, and as far as root cause goes, this is another thing that Dr. Kibola can weigh in here, because we also want to think about root cause as to what's driving cravings. And sometimes it's things like candida overgrowth, like you took a bunch of antibiotics and now you're full of yeast and that's causing you to crave carbs. But it also can be that reward system where you're like, why are you needing this dopamine hit? Was it that your mom always gave you candy when you did something good? Or is there something, emotional tied to the food? So there's always, there's lots of layers to think about.
Yeah, really, really good. While we're on the topic of fads, I have a question for both Dr. Robyn and Dr. Kristie. there were questions about gua sha and dry brushing, red light therapy, grounding sheets, vibration plates, having collagen, like ingesting it or applying lotion for cellulite, things like that. So these ladies are wondering what's a fad, like just an internet thing, and what's actually legitimate.
Well, I could do because it was on my list, the gua sha thing, which honestly I had to look up, so. So that's the scraping thing where it's an ancient Chinese, and it's also often paired with acupuncture where they do a scraping of the skin. And it can be two different ways. It can be very gentle, and when you're doing it very gently, it does help with lymphatics. So people who have had, say, mastectomies, sometimes they have a lot of lymphatic issues, and you could do very gentle scraping. There's another way if you're having pain where they're doing it much more firmly, and you can see these like bruises all along the back. And that increases blood flow, and it has been shown to actually decrease pain. Not long-term, but short-term pain. So there's danger to this too, though. So I know that I've had one patient in particular who had Bartonella, which is a tick-borne illness, and she did some gua sha, I didn't know the term, but the scraping and a deep massage, and was so sick because what happened was it just moved all of that toxin, because the bacteria loves to live in the fascia. And it basically moved everything that was under the skin now into her bloodstream, and she was so sick she couldn't handle it. So you have to really, there's pros and cons to it. As far as dry brushing goes, it's kind of the same story. It's just a gentle scraping. There's a lot of lymphatic drainage is really useful. There's different techniques. I don't know if has any of you learned about the tapping, where you do the tapping to open up the lymphatics, and then you do very gentle massage, and it's very good for breast health, for example. That if you do the tapping and then you do gentle massage, it can help drain fluid that's stagnant and can be very healthy.
Other things that were on my list were, I think, red light therapy. I recommend red light all the time. I have a red light. The hard part is like what's legitimate out there in terms of red light brands and that kind of thing. So I think the one that I've used is Red Light Co., right? Is that the one we've got?
Red Therapy Company.
Yeah, Red Therapy Company. That's
Juve.
The one I have at home and we have in the clinic. That's been really great. What are the other two?
Juve is one, and then Platinum. So there's a book out there called Red Light Therapy by Ari Whitten, and he actually took a whole bunch of different red lights and tested them to see which ones have the right frequency and how intense they are. And so he recommended those 3 brands. Now the book is a little older. There's probably other brands out there that work well, but you do have to be careful. And then you also have to use it. It's interesting, if you hang it on the door and you don't use it, for some reason, it doesn't work. So I put mine in the bathroom, and literally in the morning when I'm brushing my hair, and after I shower, I just brush my hair naked, and I'm just standing in front of the red light and, brush my teeth and do a devotion. I turn around and have my back to, and I do a little devotion in the morning. So that's how you can utilize it. You just have to work it into your life.
So red light can be really helpful for mitochondrial health. Mitochondria are the engine inside every cell that we have. A lot of the chronic disease that we're plagued with is actually related to mitochondrial dysfunction. So it can help, especially with chronic fatigue. It helped me tremendously. So I will do that in the morning, 5 minutes on each side of my body. It also can be used for skin health, like a lot of people with acne or wrinkles, they like it for that, or hair growth. Also, it can help with inflammation in the tissues. So if you've had an injury, my husband used it. We actually got it for that reason. He was having shoulder surgery, and he actually didn't use any narcotics after a rotator cuff repair. He just used that and the other things I had him on to recover. It helped so well. He healed really quickly. You just have to be careful. You can overdo it, which he did, because men don't always listen. So So he was like, well, 3 minutes is great. Surely 10 minutes must be awesome. So there is kind of a bell curve, especially if you have like a intense light, right? There's a bell curve, and it can be really great and decrease inflammation, and all of a sudden it can increase inflammation. So one day he woke up and he had a big hematoma right under the incision site. And I'm like, how long were you in front of that red light? And he's like, well, 10 minutes. And I'm like, oh. So anyway, but otherwise it helped when you listen. So red light's great. I use it all the time. Other things that they asked about were grounding sheets. I think grounding is really, really good. I do the old-fashioned kind where I go outside, but it can be helpful. You just need to be careful. Like if you get grounding sheets or a mattress pad, which actually I was just talking to my husband about maybe getting one for me. You want to make sure that your outlet actually is grounded. And there are. The company that I would look at is earthing.com, and they actually have a tester. So you can see, like, is this outlet actually grounded? So you can tell, and you can see if the product's actually working too. So if you were going to do a product, but I think Kristie says you can hug a tree in the winter too. That works as well. But it does help decrease inflammation, helps with your immune response, wound healing, even autoimmune conditions. And then vibration, I'll talk about that. Vibration in place, I personally haven't done it, but I have a lot of patients who have, and I recommend it. I just haven't done it, but it can really help with lymphatic drainage. So that's another thing it can help with. But also I think about us as we're getting older and our bone density wants to go down. It can really help with bone density. So were you going to add to that?
Yeah, I think bone density, it's got a lot of research on that, and they actually did a study on young women who are doing Depo-Provera shots. These are young women who actually were diagnosed with osteoporosis in their 20s, like late teens and 20s. So don't use the Depo shot, folks. But they put them on the red light therapy. The girls that did it, so it was an unblinded study, not red light, okay. Vibration plate. So the girls that did the study, if they did consistently 10 minutes a day, all of them had their bone density go back to normal. Now they were young, right? So they have all the hormones and everything, but it helped repair. So for someone like me, I have little bird bones. I'm going to have osteoporosis if I don't watch it. So, just 5 to 10 minutes a day can make a huge difference, and it feels good.
Collagen. All right, I don't really believe in applying collagen topically. I don't think that does anything, so don't do that. You're wasting your money. It is a big molecule. You can't just absorb it through your skin. It's not going to magically sew itself in. There's a debate about taking it orally, like how much does it help? Because you have to take this big molecule, you have to break it down into amino acids and all of the parts, and then your body will build it back into collagen. If you have low protein intake and stuff, it's probably a good idea to take some collagen because you probably need it. But if you're carnivore, you maybe don't. Okay, does that make sense? And a lot of us, myself included, really work hard to try to get enough protein. So if you're looking specifically to try to get all the building blocks you need for collagen production, taking collagen is not a bad idea. Just keep in mind that you need other nutrients to actually make collagen too. Vitamin C is really important, zinc, copper, manganese, and vitamin A. So you need all of those to actually make a collagen molecule, not just amino acids. So we just have so much nutrient deficiency because our soil is so depleted. So you can eat a really awesome diet, and I do testing for nutrient evaluations all the time. And people who are rock stars eating amazing, if they're not taking a multivitamin, they're almost always deficient, which is so sad. But there are 3 things I have everybody take: a good quality multivitamin with methylated B vitamins, fish oil, and vitamin D3 with K2. Like everybody, even littles that come in to see me,
add one thing to that, magnesium.
Yeah, magnesium's like number 4. Yeah.
Whew. That is a lot. That's good. I feel like I need to have a break. Have a piece of chocolate.
I'm picturing
I'm kidding. Just kidding. I'm kidding.
I'm picturing little candy dishes,
really,
like supplements. Here you go.
It's really good stuff. I got a couple questions for Dr. Kibola. Number one, about ADHD. Dr. Kibola, they're wondering is there a cure for it? And the second question is, someone was told they were asexual. Is this something that can change or get better? Or am I always going to suffer with this?
I'll start with the ADHD question. So, attention deficit disorder, there's hyperactive and there's inattentive type. Typically, you get diagnosed with this in childhood. And there are various theories out there for why it comes about. Some say it's a delayed migration of certain brain cells. But at the end of the day, what happens is your frontal lobe, right, which is responsible for what we call executive functioning. Executive functioning means making decisions, planning, prioritizing, math, organizing, that the frontal lobe is not working like it should be. So if you imagine a company, for those of you who have businesses, a company with different departments, and every department has its leader, but there is no overall head. So it's each department is basically deciding what it wants to do at whatever time, irrespective of what the other department is doing, even though it's one company. It's like very chaotic. And that's really what ADHD is. It's chaos. And so when you take the medication, or rather when we treat, and we'll talk about treatment, I kind of went ahead of myself. But when we treat with medication, what happens is that there is magically a CEO in charge. And the CEO is saying, hey, you guys do this at this time, and you guys do that. Well, you guys can wait a little bit. So there's more order, there's more organization, there's less chaos, there's more peace. Now, as far as treatment, what treatment options are there? Once you get diagnosed with ADHD, the two main treatment options, or rather the primary treatment option, is medication. And the medication is not curative. So it doesn't change your brain networks. Once the medication is out of your body, basically you're back to how you were before you took the medication. So it's more of, it helps you when it's in your system, and then when it's out of your system, that's it. Now, there is also, I'm blanking out on the name of this, but it'll come. There is also a type of treatment that looks at your brain waves. So in ADHD, it is said that, you have 3 waves. You have alpha waves, beta waves, and theta waves. And typically, your alpha waves are supposed to be your dominant waves. And those, they kind of start here and they go backwards. Now, in people who have ADHD, they find that the alpha wave is not dominant, and that the theta and the beta waves are more dominant and displacing the place of the alpha wave. And there's a treatment, oh man, I'm blanking on the name, but a lot of clinics do this. But yeah, neurofeedback, yes, neurofeedback. So neurofeedback is actually quite nice, because what neurofeedback does is that it basically reorganizes your waves and makes the alpha where it's supposed to be, the beta where it's supposed to be, and the theta where it's supposed to be. And that actually helps with the attention deficit. And this treatment has actually found to be quite promising. And so, if you're looking for something more permanent, that would be something to consider. The only problem is I think you have to do multiple treatments. Nobody really knows how many treatments you need. You may need 50, you may need 100. And so, but it's something that's really promising for treatment, more permanent treatment of ADHD.
Are you ready for the second question?
Yes.
Okay. Can you read it again? Thanks.
I think I deleted it.
It was talking about how this person has been labeled asexual and is wondering if they can grow out of it, like if there's a permanent solution to that.
Okay. So, that is I would want to meet the person because my first question, is this a label that was placed by somebody else? Is this an actual biological event that is present within the person? So that would be my first question, would be, is this biologically, has it been biologically ascertained, or is it something that other people are observing characteristics and traits of this person and calling them asexual? Now, with the biological part, that's different, right? Because there are different things that can be done for that as far as different treatments. Now, with the more, character traits, personality is asexual, that I would say you can work on it. Well, it depends. See, people have different backgrounds, different upbringings. So I'm wondering, how did this person grow up? What was the home environment like growing up? What type of experiences did this person have? Is there any trauma in this person's life? Because sometimes that propensity to be asexual or not to embrace your sexual identity, your biological sexual identity, can be because of a negative experience that has happened to you with the same sex or the opposite sex. And so I have a lot of patients, women who have been raped, who tell me that they don't want to look like a woman. They want to cover up. They want to wear baggy clothes. They just do not want to look anything like a woman or feminine because of that experience. They don't want to attract more trouble. They don't want to attract more negative traumatic experiences. So I would say it really depends on the person. It really depends on the experiences. And so, but that's what I'll say. And if there are experiences that need to be worked through, I would go to that first, right? Before deciding this is who I am and this is what I'm going to be, it's really important to work out what has created the identity that you have right now. Is it created out of truth, or is it created out of pain and maybe distorted truth because of that pain? And once you work out behind the identity, then a lot of things change. So I wouldn't rush to kind of label anybody before figuring out what's going on and work through that background work.
I was just going to add that sometimes, I agree 100% that there may be this covering up of who you are, and it may not be a conscious thing. In fact, I think most of the time it's not. Like, you don't even, when you were 3 years old and you were abused, you may not know why you're doing what you're doing. When you're 13. And also, I do agree that there's also, sometimes a physiologic thing. So there are certain genetics where there can be imbalances in hormones, and there are things that we can do to help. I just literally yesterday met a young person who was at age 6 going through puberty, and by age 9 had her period, and it was very disturbing to her. And then I think at age 10 they found out she had a hormone that was not working correctly, or an enzyme that was not working correctly, so her hormones were way out of whack. And there are ways that we can help naturally improve the function of that hormone, and also things that we could do to avoid worsening the imbalances. So there's a lot of things that we could do naturally that, this is a very complicated question, of course, and there's a lot of emotional trauma, and there's also often some physical issues as well. So, yeah.
Yeah. Okay, thank you so much. Dr. Brenda, we're going to go back to you if that's okay. This question is from someone who struggles with sleep paralysis, and they experience dark entities in their room. They recognize that this is spiritual, but they also know that there could be physical or psychological things going on as well. So they're just wondering how to prevent this from happening, if there are supplements or stress management tactics that they can do, or proper sleeping positions or anything like that. Do you have any wisdom for them?
Sure. So sleep paralysis is very common. Most people have experienced it at least once. And the explanation behind it is, the scientific explanation, is that when your body is in deep REM sleep, your physical body gets paralyzed so that you're not acting out your dreams. Now, people say that sometimes you will wake up before your physical body wakes up, and so you're in this state of being awake and aware, but not being able to move. Or the other way, where you may sleep right away and get into REM sleep physically, but still be awake. So either way, it's a very uncomfortable feeling, a very uncomfortable place to be in. And I really categorize it in the family of sleep disorders. And with sleep disorders, sleep is one of, I would say, the pillars of health. Not just, I say it's a pillar of mental health, but it's a pillar of health in general. And, there are different things that can be going on in sleep causing this. Some people have what we call sleep apnea. What is sleep apnea? Sleep apnea is when you are sleeping and you're snoring, and then you stop breathing, and then you're like, oh, they stopped breathing, and then they gasp for air, and then they keep snoring, right? So those are what we call apnea episodes. And so that's, and so some people can have multiple events like this throughout the night, and people with these events describe feeling very anxious, very panicked. But they also have other symptoms. So other symptoms are like the snoring, and daytime sleepiness is very, very common, where they will basically, in a conversation with you, doze off. Yeah, that's how bad it can be. So that's one, the sleep apnea. Another could be medication that you're taking. I prescribe many psychiatric medications that interfere with sleep, and so that could be also another factor. The other thing is, if you're eating a huge, heavy meal right before bed, I don't recommend it, but your sleep will not be great. Your sleep will not be good quality or restful. And then the other very, very common thing is stress, right? If you're very stressed, you have this thing that is just weighing down on you. You're going to bed, you're thinking about it, you're dreaming about it. That's another aspect of it. And so that's the more scientific and physical aspect of it. Now, when we go, because we are Christians, we are spiritual beings, there can be more. Many people who have given testimonies of these episodes, they will say when they thought of the name Jesus, that it stopped, that it went away. So we can't ignore that some of these episodes are demonic attacks. And I think this person even mentioned that they know that there are dark entities in the room with them. And so I do believe when it's a more spiritual, when there's more spiritual things going on, there's a kind of knowing that you get, a kind of knowing, a kind of knowledge that you get that this is just not purely physical. And so I like to think of Psalm 91, right? And Psalm 91 talks about the terror of the night will not overcome you. And so this is something that was also highlighted in the Bible. And so I really emphasize to people to guard your gates, your eye gates, your ear gates. Seemingly benign TV shows, books, conversations that you're having that are not necessarily edifying but are just to entertain you or to pass time may be creating ideologies in you that aren't Christ-like. You may be watching this show and you like the girl and she's cheating on her husband and the husband did something bad, and so you're like, yes, he deserves it, and then you're like, actually, the cheating, that's wrong, that's not biblical. But you find yourself allying with sin, and that's a problem because that opens the door to the enemy because you have come into agreement with something that is not of God. And so you really need to search your life and see, what open doors do I have in my life that the enemy is using to access me? Are there things that I've done? Do I need to repent for something? Many people will have sage, many people will have crystals, and people do spiritual practices outside of Jesus Christ. And that's a big open door. And that's one thing I tell people, go through your house, find things that are spiritual, but they're not of Jesus Christ, and get rid of them. Because Jesus wants us to be at peace. He wants to protect us. He wants to keep us. But sometimes we have open doors that the enemy takes advantage of. So read scripture, read Psalm 91 every night. For some people, I even say play it through the night. Allow it to just change your atmosphere. Have worship music in your home at all times, that the enemy is not coming to torment you. And for some people, the Lord is sharpening you. He's strengthening you. He's teaching you spiritual warfare. And so that's really a time of learning to draw closer to God and to using the weapons of your warfare, right? They're not carnal, but they're mighty in God to the pulling down of strongholds. So you use prayer, you use worship, you use fasting. Ask God to reveal to you what it is that is going on. So that's my answer.
Dang. Call her doctor/preacher. Yeah, that's good. I'm going to throw one in there that wasn't in there. Hormone replacements and nicotine. Yep, I said it, nicotine. We're going to sell cigarettes at the counter. I'm kidding. But nicotine, no, seriously, hormone replacements, identical hormone replacements and nicotine.
Okay.
Take it away.
Who gets it?
Anybody.
Okay.
Take it.
Whoever knows it.
I can start.
You start.
Those are very different topics. So maybe I'll start with nicotine.
That's the one I want.
So this is actually something that we've been learning a lot more about in the last few months and dabbling with ourselves, actually.
Yeah, I just wrote a giant chart part for it.
Yeah. So I've been actually recommending it to patients in the form of a nicotine patch, not smoking or other things. The interesting part about nicotine is that it's likely not the addictive substance in cigarettes. It's actually pyrazines. Pyrazines are flavoring additives that they've added to cigarettes and chewing tobacco. There's a study, I think it was 2016, Harvard did a review coming out and actually stating that and recommending that the FDA actually regulate pyrazines because they're highly addictive. Another thing I found out too, because I was like, I bet that's in our food. And it
Sure is.
So a lot of these highly processed foods that are so darn tasty, right? They have pyrazines in them, and that's why, you can't go by that aisle without grabbing them. So pyrazines are actually the addictive component, not necessarily nicotine. Nicotine is actually a natural substance. It's in a lot of foods you actually eat. So our tomatoes and eggplants and all of these vegetables actually are high in nicotine as well. And we have nicotine acetylcholine receptors in our brain and in the rest of our body, actually. And it's that receptor that was actually really attacked by the spike protein with COVID. And what they found was that actually smokers or nicotine users had the lowest incidence of COVID and long COVID.
Which didn't make sense because, their lungs are kind of crap, and so they should be sicker, but they were not.
They were not. So what can happen is for people who maybe are struggling with long COVID or perhaps long-term side effects from the vaccine, the spike protein can hold on to those nicotine receptors, and if we use a patch, it can kick that toxin off. And so they did some studies looking at patients who had symptoms for 2 years and put them on a 7 milligram nicotine patch. And by the end, so they only took it for 7 days, but they continued to improve even up to like 21 days. Their symptoms rapidly improved. And it can be very helpful for things like fatigue, brain fog. So I think there's actually a lot of toxins that bind to these receptors and a lot of viruses that actually bind to these receptors.
There are, and in fact, there's lots of studies out for MS.
Yes.
Improvement in Parkinson's. Even
yep.
in early Alzheimer's.
Yes.
It has been shown to reverse some Alzheimer's. And it's even good topically. Like if you have a sore joint,
yes.
you can put like a piece of the patch on your sore joint and help your brain and also help your joint. It's crazy.
Yeah. I have an uncle who has early diagnosis of Parkinson's. I sent him a bunch of information and he was having issues with movement. They get rigidity. They want to initiate movement and are feeling stuck. He said it was like a miracle. Within a week, he was already having normal movement. I was super grateful. I myself started having pain that was wrapping around, and it was shingles. I put a nicotine patch back here, and within 3 days, all gone. So there are different usages, and I'm playing around with it more. Like, hey, my son actually had gotten a virus, was struggling because he has asthma, was wheezing. We were up north. I didn't have his inhalers, and I'm like, let's just put a nicotine patch on you. His cough, 90% gone. And within 3 days, totally better after struggling for 2 weeks. So I think there's a lot of potential uses. There's the brand that's been recommended for patches is Rugby. It tends to be a cleaner patch, and you can buy it on Amazon. I'll usually recommend that patients start with like cutting a 7 milligram, which is the lowest dose you can get, into maybe 6 pieces and using one of those, which would be about 1 milligram. And then you can slowly increase it with time. There's a lot of people who will maybe go up to that full 7, especially if you've had maybe long COVID or something like that. I'll tell them, do that for a week, then back down to maybe a half patch and see, are you feeling the same? Are you feeling the same benefit? to see if they need to do that larger patch longer. And a lot of people are actually doing the half patch for like long-term cognitive protection because they are seeing benefits with cognitive decline. And these early Alzheimer's patients was actually improved cognition. So, and I want to protect my brain.
Where would they put this patch?
So, go ahead. You can put it anywhere. It depends on what you're using it for, though. So if you've got maybe arthritis in your knee and you want to see if it's going to help, you can put it on your knee. Or like for me, I knew the nerve was coming out back here in my back, so I put it right over that spot. But otherwise, if you're using it for cognition or something like that, I don't really think it matters where you put it.
It doesn't matter. You can put it anywhere. Yeah. But a tip, put it on in the morning. Don't start it at night, because if you do, you probably won't sleep. My husband tried that. And so the rugby patch will say that you're not supposed to cut it, and it will say that all over the patch, but you can tell the patch was stamped out of a sheet. So if they can cut it like that, you can cut it. So it's fine to do that. And what else about rugby? Yeah, rugby's, yeah, probably the cleaner patch. So that's the one to probably get.
Mm-hmm. I would just be careful. I guess, you know how on Amazon you can get lots of different people selling, but they're maybe not the true distributor. I would just be careful and watch who's actually distributing it and that it is actually from rugby. So that's the only thing I would say.
Not everyone can tolerate the full patch. I worked my way up to, well, I went to the full patch, and then my heart started pounding like crazy. Like, I could not sleep because it was pounding. So I could do 3/4 of a patch just fine, so that was my dose. So everyone's body's a little different.
How do you spell that?
Rugby, R-U-G-B-Y, just like the, yep.
What about gum?
You can do the gum, but there's more side effects with GI issues. Some people really get nauseated. Not everyone. And people who have oral fixations, who tend to, want to smoke or vape, the gum is an okay option.
I just get nervous about what are they all putting in there. You know what I mean? Like anything that has flavoring additives or any of that kind of stuff, I just get nervous about that. And so I think the patch is better, and we haven't had issues with addiction with the patch at all.
I would agree. So if you're going to do the gum or a mint or a lozenge, you got to be careful not to have aspartame or artificial sweeteners in there, because a lot of them, like the typical nicotine gum, has that. And Knick-Knack is a real clean, if you want to do it orally, I would do Knick-Knack lozenges, and Knick-Knack is N-I-K, I believe, and it's nicotine, xylitol, and essential oils. So it's the cleanest one that I've found.
Awesome. So our first question was about hormone replacements or whatever. Could you add on to that one as well?
We do a lot of bioidentical hormone replacement. So people who are in perimenopause, many people are struggling with hot flashes or night sweats, and that's a real complicated thing as well. But you can do hormones very safely, and when we're doing bioidentical, that means it's the same exact structure as what your body makes, and it's also in the same dose. So we don't want to do sky-high doses. We want to do, roughly at the amount that your body would make, and we want to do it in a good balance. So we can check this with either saliva testing, or we can do, in some cases, some blood testing, urine testing. It can be very beneficial for many reasons. Yeah. So I think it's great. We know that bioidentical hormones, actually there's a lot of research. There's a woman named, name will come to me, my eye's getting more wonky, so that means I'm tired. Lindsay Berkson, and she wrote a book called Smart Women, Smart Hormones. And this book is like about that much, is kind of just explaining why the hormones are not unsafe and why they might help you. And about that much is research. There's tons of research around the world that this is safe. And we know that we live in a world that's very toxic. Lots of fake estrogens around us. Synthetic fragrances, for example. If you have a Glade plug-in, you are getting estrogen-like compounds. And so if you're taking bioidentical hormones, especially if you're perimenopausal, it's going to occupy those receptors and do what God intended it to do. And it's going to block that Glade plug-in chemical from attaching to your body. So it can be potentially, decreased risk of cancers and things like that.
I think I'd just add, I think a lot of people jump maybe to hormone therapy too quick. There's a lot that we can do to help set you up for maybe even not even needing hormone therapy. So I think that's where functional medicine excels, is like, let's address the terrain of what's going on in this person, because we can usually help a lot of those symptoms without necessarily having to jump right to hormone therapy, but it can be added if need be. Does that make sense?
Correct. Yeah, you always want to look at the root causes, look at the base. Yeah.
Make sure they're eating well, they're sleeping well, what's their exercise regimen like, what's their stress like all that stuff needs to be addressed. And a lot of times those things are actually causing hormone imbalances, especially in that perimenopause time. So if we address that, you can kind of breeze through perimenopause a little bit better and maybe not need so much help during that time.
And yeah, sometimes these hot flashes that people are having are not really hot flashes. They're from tick-borne illness or,
or even adrenal issues.
A lot of adrenal issues.
Times. People come in their 30s like, I'm going through menopause. I'm like, no, you're likely not. You likely are very stressed and your adrenal health is probably horrible. So let's start there.
Just one more. Can the nicotine patch help someone with Parkinson that has had Parkinson's for 10 years?
Potentially, yeah. It's just the degree, but I would definitely do it to see, because the risk is so darn low and the potential for help is real. So I would.
Perfect. We have 15 minutes left, so I want to apologize. We will not get to all of the questions this evening. Because we only have 15 minutes left, I am just going to be sticking to the questions that were submitted prior to the panel, just to honor the people who put in the effort to do that. So Dr. Brenda, I'm gonna combine two of the questions that I gave you ahead of time about sex. So the first question I have is, it's referencing studies about the detriment of women having multiple sex partners. They're wondering, what are the physical and psychological ramifications of having multiple sex partners beyond emptiness and STDs, STIs? But then I also, if you could attack this next question as well, this woman is wondering if it's biblically permissible for a wife to not have sex with her husband for long periods of time, and is wondering what God's word says about sex in marriage. So if you could just hit the sex right now, that'd be great.
All right. All right. So there are studies that show, and these are observational studies. You can't necessarily do a randomized control trial, but there are studies that show that people who have multiple sex partners long term have more health problems. They also show that they have a greater likelihood of getting a substance use problem or addiction. And higher divorce rate as well. So there are consequences to having multiple sexual partners. What I will say is this, that when you are thinking of or when you have that maybe propensity or behavior, typically, not all the time, but typically it's in the context of that person looking for connection in places that are not healthy. And actually, that's why they end up being multiple sex partners, because you look for the connection with somebody, you get it for a little while, and then you realize it's no longer there, and then you find it with somebody else, and then that connection is no longer there. So the sex is more of an expression of, for us women, really looking for connection, looking for validation, looking for love. Happens typically when there's been some type of parental absence, emotional growing up, and that individual is just looking to fill that void. And so, here, I would really say is to really understand that need, what's going on behind wanting to have multiple sex partners, because what happens then is, when you are coming together with multiple people, you're not having the space and the room to build a secure, stable relationship, to build trust, to grow. All of that is off the table because there are different people involved. And so what happens is that a lot of the possibly underlying needs that caused this behavior are actually perpetuated and actually get worse, because it is confirmed time and time again that this need is not being filled. Now, the other thing, so I also want to say this. In Genesis and also in Corinthians, right? In Genesis, God said, a man shall leave his mother and father and cleave to his wife, and the two shall become one flesh. In Corinthians, it says that when a man comes together with a prostitute, that when they come together and in sexual contact, that they too become one flesh. So there is a deeper spiritual significance to sex than just the act. Sex was created to solidify a marital union. And people even say that the blood that a woman has, with the hymen breaking during the first sexual encounter is symbolic of a covenant, right? A covenant agreement that has been made. And so when you are becoming one flesh with multiple people, what happens is that you become fragmented. You become fragmented because you're not becoming whole, right? You're kind of here and here. And there are people who actually can, get, I don't know how much, but get spirits from other people. When you come together sexually, there is a transfer. A lot of people who've participated in witchcraft, especially where it's been passed down along the family generation, whether they're trying to pass it down to their child or their nephew, they participate in sexual acts to actually transfer those spirits, transfer those powers to the person who is inheriting it. And so that realm recognizes the significance of sex in the spiritual realm, but I think as Christians, we take it for granted how powerful that is. But I will say this, right? When Jesus met the woman at the well, and he said, you are drawing water, but I will give you water, and you will thirst no more. And they kept talking, and Jesus asks her, "Where's your husband?" And she says, "I have no husband." And Jesus says, "You're right, because you've had 5 husbands, and the one that you're with right now is not your husband." Now, he didn't condemn her. He didn't shame her. He didn't say, "You're so bad, you need to stop that." He said, come to me, I will fill that void. I will heal that pain. And I will make things whole again for you. And so even in our brokenness, there is wholeness in Jesus. And so to really seek him and not other people, even if you have your husband, but if you're seeking a husband, if you're seeking your child, if you're seeking other things outside of Jesus to fill that void, it won't do it. It won't do it. And then the next question is to do with, what's the next question? Yes, okay. All right, okay, let's see what I have here. Okay, I just have some scriptures that I have. All right, so 1 Corinthians 7, I'll repeat the question because some of you may have forgotten. Is it biblically permissible for a wife to not have sex with her husband for long periods of time? What does God's word say about sex in marriage? This is a great question. 1 Corinthians 7 verse 4 to 5 says, the wife does not have authority over her own body, but the husband does. And likewise, the husband does not have authority over his own body, but the wife does. Do not deprive one another except with consent for a time, that you may give yourselves to fasting and prayer and come together again. For what reason? This is the reason. So that Satan does not tempt you, right? Because of your lack of self-control. So biblically, no, it's not permissible, right? But it's for a reason. You know, when you look at the Bible, we need to look at it as God's love letter to us. That the things that he's giving us are for our own protection, for our own security and safety. And so here, you know, sex was created by God. It was created to strengthen the union between a man and a woman. And when you come together, right, that union, every time you come together, that union is solidified time and time again. But when this is missing, and this happens for various reasons, there comes issues, right, in the marriage, because Satan sees that. He sees it as an opening to bring bitterness, resentment, blame, and everything else you can think of. He comes to steal, kill, and destroy. So now the bigger question here is, why is there no sex in the marriage? That's the bigger question. And now I think the best thing to do is to really be open and honest with yourself, with your husband, and to really talk about it. Is it a medical condition? Is it some people have sexual trauma? Some people have medication side effects. So the lack of sex can be for various reasons, but the first step is not to ignore it, because ignoring it will cause the problem to become bigger. The fact that the question is being asked is the Holy Spirit really stirring you. So the first thing is to really say, okay, this is a problem. How do we address it with the resources that we have? Do we need to see a doctor? Do we need to talk to somebody? Something can be done. And in the meantime, as you're working towards it, are there alternate ways of coming together affectionately as husband and wife during those episodes? You know, because the thing is, we are all broken, right? We are all broken. We are broken. We come into the world broken. There is sin in the world. And the Lord says that his power is made visible in our weaknesses. And so it's really submitting that to the Lord and really even holding him to his word. He says he holds his word above his name. And so when you say, Lord, you gave me this husband, but I am not able to fulfill this, what you say in your word. Answer this for me. Come through for me. He will. He will. But we also need to be faithful in pursuing him. So that's how I'll answer that.
Yeah, that's really, really good. Thank you so much. Really good. So if you ladies are okay with it, I have one more question and then we will close. This question is for Dr. Kristie, but either of you can add to it. Dita and I were talking beforehand and she's like, I wonder how many times you're going to say vagina tonight. And I don't think that I have a single time until right now. So you're keeping me in check. I got you, girl. So this question was asked by someone who is experiencing vaginal odor, especially after sex, and having issues with balancing their pH levels, even though they're taking probiotics, using pH inserts, and are cautious about the soaps they use. So she's wondering, is this normal? What can I do?
That's a great question, and that's complicated, like all of them tonight. So the balancing of the pH, we know that the vagina is supposed to be acidic, and that the semen is often, it's basic. And so when the two come together, it neutralizes things. The way that we maintain the acidity in our vagina is to have Lactobacillus acidophilus and a number of other lactobacillus, so special bacteria that actually ferment sugar and cause an acid to be formed. So it's very easy to have that shift. So if you've had antibiotics, that is something that can cause a shift. Oral sex can cause a shift because mouth bacteria don't necessarily belong down below. Different things in the semen can cause a shift. So there's, it's like men who are drinking a lot of caffeine, for example, that can cause a shift. And so you can have this odor. If it's a real fishy odor, it's often caused by a bacteria overgrowth called Gardnerella vaginalis. And the Gardnerella can be cleared up. We can give antibiotics that can clear it up, but the problem is it usually comes back over and over again. And so that's where we want to really help nourish the good bacteria down below. Using the pH inserts can be useful. Boric acid is something that can be helpful. Sometimes you want to take probiotics. We have some probiotics that are very specially blended for women that have the good bacteria in there. Those are some things that can really help. And Dr. Robyn, any other thoughts?
Other things that are coming to mind that I'd be careful about is just other products you're using. So even vaginal moisturizers or lubricants or that kind of stuff, especially if it's always after sex, I'd be wondering okay, are you using anything else that might be throwing off the pH, lubricants or otherwise that might be throwing things off? And just like everything else, there's toxic and non-toxic ones. So I'd be thinking about that too, if that's in the mix at all.
Totally agree. Yeah, coconut oil is a nice option because it has, it's good for the good bacteria. But yeah, there's a lot of the synthetic lubricants that are like Glide and some of those other synthetic ones that are not great. Yeah, that's...
Mm-hmm. If I had to pick a probiotic, I've actually had a lot of luck with the Megaspore probiotics that they have, a vaginal balance one.
It's really nice.
And I've had some patients who we were struggling with trying to get their balance right, and that's worked very well.
We can do vaginal cultures.
Yeah.
So, when we're really stuck and you've tried everything, we would do a little swab, and then we just send it off, and we see what kind of bugs are in there, and that can help us correct things too.
Not literal bugs, but
Not real bugs, sorry. Bacteria.
Bacterias.
No visible bugs.
hopefully.
Where did that cricket come from?
Okay. Well, I think this is a really good note to end on. So I just want to thank you ladies for submitting some really, really awesome questions. Again, so sorry we couldn't get to all of them, but we will be having a panel next month. It's not going to be about physical health, but it will be about mental health. And I know that there were some questions about mental health things in here. So I would just recommend resubmitting those questions for next month's panel. That will be October 28th, right? October 28th. Perfect. It will be Tuesday, October 28th at 6:30 p.m. And we will release the location when we know the location. It'll be here? Okay, it'll be here in this building.
Sorry.
So thank you all so much for coming out. If you wouldn't mind just giving our panelists a round of applause, please.
Yeah. This was really, 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 really good. Thank you, ladies, for coming. We have some flyers out there for the next event, and also they have some stuff out there. Well, they don't. They forgot it. Anyways, guys, if you have not looked up Sparrow Clinic, I've got 2 cards. So take a picture. Take a picture, and then that way you can have the information. But if you have not visited their clinic and you're having any issues that we talked about tonight, I really highly recommend that you make an appointment. It'll be worth it, for sure. And then, of course, Dr. Brenda's got some really, we'll talk more on the mental health. She's on the panel for the mental health also. So anyways, thank you ladies for coming, and check out our website. If you guys want to stay connected to any events we have, fill out a Connect card. You'll find it in the back there. Fill it out. That way you guys get our emails, okay? And if we're going to have some ladies up here, if you ladies, anybody in here want prayer, you know that prayer works for physical issues? Ladies, shake your head. Yes. So if you're having physical issues and you want prayer for your bodies, we're going to have some women up here that can take care of that for you. Otherwise, see these guys. All right. God bless you, ladies, and have a great night.